Hello, everyone. I am Dr. Tawab, co-chair of ISPRM Communications Committee, and I guess this is that time of the year when we start having interviews from the keynote speakers in the upcoming ISPRM conference. So this year, the conference is going to occur in Sydney from 1st to 6th July, for which we all are like really, really excited, and it is like just around the corner. So today we have Dr. Reynaldo, who will be delivering his keynote lecture on the use of WHO Guide for Rehabilitation Workforce Evaluation, building local capacity for the rehabilitation workforce. Before I begin with the formal interview, I would like to introduce Dr. Ray, who is an associate professor and chair of St. Luke's College of Medicine and Medical Center, Department of Physical Medicine in Rehabilitation. So he has many years of his experience as a clinician and as well as an educator. He was chairman of Philippine Board of Physical and Occupational Therapy under the Professional Regulations Commission, and he was the president of the Philippine Academy of Rehabilitation Medicine as well. So he has just finished his term as the president of Asia Oceanian Society of Physical Medicine and Rehabilitation. He has been awarded multiple awards, including the Educational Impact and Excellence Award by the U.S. Association of Academic Physiatry, and he was just awarded the Outstanding Thomasian Medical Alumni in Medical Education by the Pontifical University of Santo Thomas Faculty of Medicine and Surgery. Welcome, Dr. Ronaldo. How are you doing today?
Yeah, I'm fine, Tawab, and good day to everyone who's listening and viewing this interview.
Yeah. So, Dr. Ray, what was your inspiration behind, picking this very, I would say, important topic, and rather a very interesting and important topic for your keynote lecture at ISPRM?
Tawab, we know that a critical shortage of rehabilitation workers and issues of quality of care pose a major challenge to many countries working to strengthen rehabilitation in their health systems. A well-trained rehabilitation health workforce is key to meeting local rehabilitation needs worldwide. Current models that rely solely on academic degree-based education may have worked well in some countries but may not be practical in others. So resources can be a key issue. And out-of-the-box thinking is critical to upgrading local capabilities and capacity. The Hong Kong Society for Rehabilitation, in partnership with the World Health Organization Regional Office for the Western Pacific, is convening a training workshop to equip technical experts to support countries in implementing this WHO Guide for Rehabilitation Workforce Evaluation, or your GROWE. I owe to ISPRM the opportunity to be trained in this workshop and play a mentorship role. So I think this keynote lecture can be the best time to echo this endeavor to all of you.
So, can you briefly describe what the GROW is?
So Tawab, GROW means the Guide for Rehabilitation Workforce Evaluation. It is a technical product that was designed to assist countries to strengthen their rehabilitation workforce. We know that a diverse composition of skilled workers is fundamental to ensuring the quality rehabilitation available to all who need it. The state of rehabilitation workforce is influenced by the health needs of the population, the demand for and supply of rehabilitation services, and broadly, the governance of rehabilitation health workforce. Together, these factors influence the availability of funded employment positions for rehabilitation workers, their wages and allowances, the number of hours they work, their geographical distribution, their employment settings, even their motivation, productivity, and performance.
So, Dr. Ray, so how do you think that GROW can, help in capacity building in the higher income countries versus the lower income countries?
The findings of GROW are designed to provide a granularity of data that will enable the development of an operational national action plan. The data can also trigger important discussions concerning the management of gaps in rehabilitation care that stem from shortages or the absence of specific occupations in a country. At this time, researchers show that the density of rehabilitation workers are lowest in the African region, followed by the Eastern Mediterranean and the Southeast Asian region.
So, Dr. Ray, what is actually in your bucket list for the ISPRM Sydney this year?
First of all, Tawab, I need to fulfill all my responsibilities, which are as a keynote speaker, a panelist for the workshop on best practices in PRM board certification, USA and Asia, attend meetings needed as an ISPRM Exicom representative for South and Southeast Asia, and other committee meetings of which I am a part, like that of the World Health Organization and the Education Committee. But I think more important than that is that this conference will provide me the opportunity to meet again our international colleagues, meet you in person, Tawab, and enjoy the camaraderie. Especially, it's in Australia and it belongs to the Asia Oceanian region, of which I am the immediate past president of the Asia Oceanian Society of Physical and Rehab Medicine. So I am quite excited for this event and hoping to see you all.
I'm also looking forward to meet you personally in the conference. And just a reminder to the audience, the registration, the early bird registration is going to end on 31st of January. So I request you all to hurry up and just register yourself so that you can listen to the amazing talk of Dr. Reynaldo in Sydney this year. Thank you so much, Dr. Reynaldo, for giving us time and joining us today. Hope to see you in Sydney in June.
Thank you so much as well and hope to see you, Tawab, and hope to see everyone there.